This is part two of a two-part series I call Dietary Blunders. That is, dietary blunders I have made personally that got me started in thinking a lot more serious about diet and trying to get it right. I'm Dr. William Davis, author of the Wheat Belly and Undoctored books. Well, in the first part, I talked about how I became a very strict, low-fat vegetarian. Very strict, very low fat. And it ruined my health, at least temporarily. I had disastrous metabolic markers like a triglyceride level of 390, and I became a type 2 diabetic despite a very serious exercise program. I went off that program and everything reversed. But another lesson I learned along the way is when I helped open a heart scan facility. This was back about 22 years ago. Back then, the technology that we used to scan for heart disease, screen people for heart disease, was called an electron beam tomography device. The current devices are multi-detector CT scanners, but back then, 20-some years ago, it was the EBT device. And we were scanning people. It was a very excellent device, by the way. And we scanned people looking for plaque in their heart's arteries. You score calcium. The reason you score calcium in the arteries is because calcium occupies 20% of the total atherosclerotic plaque volume. So it gives you kind of an indirect or dipstick for total plaque volume. If you have 2 cubic millimeters of calcium, you have 10 cubic millimeters of atherosclerotic plaque. And so it was a very easy way to quantify total plaque. People sometimes say, oh, that's just hard plaque. No, it's an index of total plaque, all the components of plaque. But we use that scoring method to gauge how much plaque you have. Normal is 0. Well, people were coming through this device every day and having very high scores, 500, 700, 1,000, and thereby at substantial risk for heart attack, even though they had no symptoms. Well, what do you do when people have these high heart scan scores and thereby risk for heart attack, death, etc.? Well, back then, 20-some years ago, I said, well, cut the fat in your diet, right? Take a statin drug like Lipitor, take aspirin, and exercise. People would do that. What happens to these heart scan scores if you do nothing? Nothing at all. Because we contribute some of those data. The heart scan goes up 25% per year. It's horrifying how fast atherosclerotic plaque grows when you do nothing. Okay, so 25% per year. Well, we help contribute the data for these studies. What happens when you put somebody on a high-dose statin drug, aspirin, a low-fat diet, and an exercise program? How fast does a heart scan go up? 25% per year. It has no effect at all. That's widely known. That's well established. But even to this day, I hear colleagues say, oh, you have a heart scan score? Let's put you on Lipitor. No, no, that will have no impact whatsoever on the progression of the heart scan score. There's some other issues in there for another time. But it taught me that a low-fat diet does not do anything for heart disease and for gaining control over atherosclerotic plaque. And by the way, nor do the other things I mentioned. So that's what led me down this other path, where I started doing what's called advanced lipoprotein testing, like NMR, nuclear magnetic resonance. And all that is take a sample of your plasma, that is the blood with the red blood cells removed, and it's clear, and you put it through an NMR device, or an MRI device, same device. And you quantify the proteins in there. Well, guess what? Virtually everybody who has a positive heart scan score, and thereby heart disease, has tons of small LDL particles, okay? What happens when you go on a low-fat diet? Small LDL particles skyrocket, and triglycerides go up, and HDL comes down, okay? But the real cause for heart disease are the small LDL particles, and they explode on a low-fat diet. So I asked back then, well, gee, we have all these people terrified now. Their heart scan scores go up, on Lipitor, on Zocor, on Crestor, on aspirin, on a low-fat diet. So I asked myself, what causes this explosive quantity of small LDL? Well, these data had already been performed, like Dr. Ron Krauss at UC Berkeley, University of California, Berkeley, and others had performed these studies. Grains and sugars cause small LDL particles. So I thought, all right, let's give it a try. The conventional answer is doing nothing, right? People are going to have heart attacks, going to die on their statin drugs and aspirin, etc. So I asked people, let's take all the wheat and grains and sugar out of your diet. They looked at me puzzled. No, what? We did it. Small LDL particles plummeted, often to zero, from numbers as high as 2,400, 2,800, 1,900 to zero. HDL goes way up, triglycerides come way down, blood sugar comes down. Type 2 diabetics often become non-diabetic. People lose weight from visceral fat. That's what led down the whole wheat belly path. But it was an illustration of how ineffective, how useless a low-fat diet was. But I had to learn the hard way. My own mistakes and the mistakes in patients, telling people to cut their fat. So I hope you do not limit your fat. I hope you don't buy low-fat products, low-fat dairy products, skim milk, none of that nonsense. So in the wheat belly and undoctored lifestyles, we enjoy our fat. If you buy a steak, eat the fat. Buy a fattier cut like ribeye steak. If you buy ground meat, never buy lean. Always buy full fat. Add more butter. Add more coconut oil. Okay? Do not limit fat. It's silly, it's unnecessary, and can even promote heart disease if you cut the fat in your diet.